Hi everyone. Wow, what a couple weeks has changed the nature of emergency care in this country. Seemingly, two really important things going on that we have a chance to discuss quickly. Number one, it is freezing cold, and there's more very dangerous cold weather coming in. And second is the infectious diseases took a break through the month of November and December, and then really the last week of December have really taken off. So we'll talk about infectious disease issues. First life threat in front of us is there's more than two-thirds of the country going to be under very severe cold conditions next week. What does that mean? It means you get caught outside for some reason, and there's a potential that you get frostbite or you get hypothermia. Those are both serious medical conditions. You think of both of those diseases just exactly the way that you think of burns and of getting too hot. And so, our indicators of frostbite are the same thing that happens with burns. You get blanched to red, ends of your digits or your ears, your nose, parts of your face, and then they blister. And so it really is very much like a burn. And to your skin, it's about the same thing. Too hot or too cold begins to break down your fingers and toes' ability to get blood flow to the very ends of them. And when that happens, they begin to separate, and they separate in order to protect what's underneath, because the more important stuff is underneath the exterior layer. And so it separates away and puts a layer of fluid in between there. And that's what the blistering is with either frostbite or with burns. Most Americans at some point in their life have had a burn that blistered. And so you're familiar with that. And the first thing I want to tell you about frostbite is you take care of frostbite in the very same way that you take care of a burn wound, only initially you warm it, you don't cool it. With any burn, the first indication that you have that something is burned, you take your whatever is burned and you put it under cold water. That's a really good thing to do. When you've had frostbite, you've had to have had exposure for some time of the exposed area, and I'm just going to keep using fingers because they're the most common place. And they begin to feel really hot, tingly, stinging pain, and it's telling you, I want out of this environment. And if you keep ignoring it, then eventually what has to happen is it begins to damage those layers and the skin begins to blister up. You need to, at that point, in order to prevent further damage, get to a warm environment. So that's what you do. The next thing that you need to do is not rub anything on it, just the way you wouldn't rub a burn, just the way you don't break blisters when you have a burn. You leave that intact. You don't put mayonnaise, meat, butter, sunburn cream, none of those things on it. You warm the fingers, the nose, the ears up to the best of your ability, and then you apply just a soft dressing on it to keep it from being rubbed open. If it's severe, you go to the emergency department to get treatment. If it's not severe, then you take care of it like you would take care of a burn, which is just a simple antibiotic ointment or Vaseline over the top of it to prevent it from getting infected. Cold injuries. Cold is when your body's temperature begins to go down. You know, a normal body temperature is about 98 degrees. Your first reaction to getting cold is you shiver intensely. You don't shiver as intensely if you're intoxicated. Okay. And so, intoxication, not a good thing if you're getting cold. As a matter of fact, all of you know that on a warm day, when somebody begins to drink, and if they have a complexion that's reactionary like mine, they get really flushed. That is because alcohol dilates the blood vessels closest to your skin. In a cold situation, that is really bad because that means when those blood vessels dilate, they're full of blood. They're releasing heat out into the environment, which is what you do not need when you're already getting cold. So hypothermia is about you getting cold. You move beyond the point where your body can tolerate it, so it begins to make all the major muscle groups work, and that's what shivering is. You get below a point about 92-degree core temperature where you stop shivering, and that's where the really dangerous things begin to happen. The next thing you begin to you have no ability to control your temperature, and one of the reactions is if you have protective clothing on, some people will begin to tear it off. At that point, they're in danger of life-threatening hypothermia. So that's altered level of consciousness. And last summer we talked about altered level of consciousness being an indicator of the temperature way too high. So it's the same thing with hypothermia. The trick to hypothermia is get them warmed. And you do that by getting anything wet off of them. Wet transmits heat even faster. You get them in a warm environment. You get them under warm blankets or something else that preserves body heat. If you're in a wilderness condition, you add body heat to them, which means you or something warm gets in next to their body underneath a blanket, sheet, something like that, a jacket, and you begin to contribute your body heat to the other person's body heat. Or the same thing with a 3-dog night, which is you put 3 dogs next to you, which dogs are natural radiators of heat. So that is the way that you begin to warm people back up. The last thing that you add is something warm in their stomach. You don't want somebody throwing up. And drinking hot beverages makes you feel good, but really isn't a way of adding significant BTUs to your body. So please avoid those conditions. Protect yourself when you go outside. Protect all your body surfaces. Don't be exposed outside if you don't need to when you're intoxicated. That's the very most dangerous time. And in situations where you have to be outside, make sure somebody knows where you are, is keeping an eye on you, tracking you, so that you don't get trapped outside somehow and can't get back in. So that's hypothermia, and it's going to be a problem next week. Very quickly, we have infectious diseases that are at very high levels across the country. Flu A that we have talked about, RSV, which is the little kids and the older people's respiratory infection. COVID is here, but not really a problem. The other big number 4 problem is norovirus, the cruise ship virus, the puke and poop virus. All 4 are now being called the quadridemic for what it's worth. Protect yourself. Don't be breathing air that other people have exhaled. Wear a mask. If you're protecting yourself, wear an N95 mask. Wash your hands. And the protection against norovirus is not alcohol cleaners, it is soap and water. Soap and water more effective in protecting people from GI viruses than alcohol, the alcohol creams and foams and other things. If you're in public, think about wearing a mask. And we're at that stage where at the airport, people are wearing masks appropriately, and they're N95s, which are protecting them. We have probably another 4 weeks of outcome, 4 weeks of really significant flu spread. And then we'll probably be done. But by then, a lot of you are going to be sick. I want to try to prevent that by having you take protective measures, particularly when you're in public, washing your hands frequently, and staying out of conditions where you're too close to people who are coughing. So we're midwinter. Please be careful in the cold conditions. Please be careful around ice in particular, and a little bit about snow, and protect yourself from infectious diseases. Next time we talk, we'll be near Valentine's Day. We'll probably talk about food safety then. Take care, everybody. Thanks for listening to Doc Talk. Take care.